Good evening, cousins, citizens, and members of the Menhir, not to mention, I guess also citizens of the Empire, from a Warhammer perspective. Gosh, citizens really isn't descriptive enough, but hello and welcome back to another episode covering a little bit more of Menhir's fate. Today we're going to be looking briefly at healing, mainly because I was just having a skim and I saw the most awesome thing at the end. We'll get there very quickly, it's not a long one, but Menhir's Fate rules writers, 10 out of 10, 3 thumbs up out of 2 for what I'm about to tell you. So, settle in, this is fucking goated. Right, healing. Oh come on Chris, you can do better. In Menhir's Fate, there are many different ways to heal wounds. From cantrips and more substantial though occasionally perilous rites, to physicians who use their mundane skills or apothecary consumables to keep people upright. Each requires the healers to expend time and role play with their patient, after which they will regain some or all of their hit points. When performing your role play, please use any tools, equipment or props and role play out the situation. This may be using bandages to bind a wound, or surgeon's tools to roleplay surgery, or even smelling salts to revive your patient. These are not an exhaustive list, but some examples of healing roleplay. Please make sure that any of your phys reps that you use are LARP safe. No real scalpels, please. If you intend to execute using this skill, please also roleplay an attempt at healing your victim. Unlike other executions, this is a subtle strike, and the call execute may be called quietly. So yeah, there you have it, right? Inside the healing rules, once you have enough XP, you have the option to kill your fucking patients. Just outstanding. You know, if people are going for the whole political murdering kind of vibe, you know, your enemies, you know, sending the good old doctor to go and help them out and just nick him in the jugular. And every single time someone dies in the doctor's care, there's always going to be this question mark of whether it was deliberate or not. I think this is going to cause so much drama, and in the LARP, that's a great thing. Love it. Right. Physician skills. First of all, Physician, 2 XP. I think you get 10 overall to spend. So your entry level skill, you need to take it before anything else, and that is 2 XP. The character may spend 1 minute to restore someone from critical to 1 hit point, so that's basically a heal of 1 HP, that's not bad. And the target's critical state is paused as soon as you begin the roleplay, so for triage and the like, this is great. The character can spend 2 minutes to assess and begin treating an infernal wound. Interesting. Don't know what they are, we'll find out at some other time, but that sounds like maybe infernal is the same as mortal, or severe, or traumatic. We'll see. Mortician, 1 XP. This allows the character to spend 30 seconds assessing a corpse and to work out how long they have been dead. This also allows the character to spend 30 seconds to work out how a person was killed, so a minute in total. If the character also has Advanced Physician, they can see evidence of hidden executes. We'll cover Advanced Physician in a moment. This allows the character to spend 1 minute, a further 1 minute, to be able to restore 1 hit point to an Underdweller. This increases with your Physician skill. No idea what a fucking Underdweller is. Let's assume it's a zombie or a skeleton or something, I don't know, but that sounds fucking cool. So, Mortician seems to be the foil to the Advanced Physician, which is the skill that allows you to call execute on a player you're healing. So let's hop straight into that to give it some better context. Maybe they should have put these the other way around, but Mortician, 1 XP, it's a cheap spec for someone who actually doesn't want to allow doctors breaking a Hippocratic oath and becoming murderers to go and counter them. You can see that they died via foul play, you can work out how long they've been dead, so is the killer still in the area, or if they find a corpse in a ditch and they go, this has been here for days, well, tough. Right, Advanced Physician, 3 XP. Advanced Physician requires the equivalent of surgical effort to heal a character. This is purely mechanical, you may still use a variety of roleplay effects to heal the person, but rather than sort of staunching the wound, you've got to really wrap a bandage round, pretend to do some surgery, fix some ribs, reapply blood to body bag, that kind of stuff. The person being healed by this process may not move or take actions such as casting spells or use faith powers or any of their vigor skills, but they may continue to roleplay while being healed. So you don't have to be unconscious for surgery. Scream, shout, cry for your mother. Good stuff. If interrupted, the patient goes into a critical state as a result of the healing being interrupted. That's fucking cool. So these advanced physicians, this is your big heal. But if it gets interrupted, it's not like the surgery fails. It fails catastrophically. So at Empire, if you stop healing someone, they go back to how they were when the surgery started, which is an easy mechanic, but it doesn't take into account that you're basically resoldering someone's fucking internal organs. This does. So if someone's doing surgery on you and an arrow hits them, you're in a whole world of heap of shit. A whole world of heap of shit. Fantastic. Great. Finally, this can only be done on a willing target. Now, I think this is really important in the context of mortician. So if you're trying to murder someone, you're probably going to trust the doctor. And if you say, I'm not willing for you to have access to my inner organs, don't touch me, then that'll save you from the sort of stealth murder mechanic here. But, saying that's maybe one of your friends or perhaps an employed doctor, it's going to do a lot of social damage, which, again, for LARP, fantastic. So, for the physician skills, you may spend 1 minute to restore someone to full hits, not just one, like with basic physician. The physician may spend 1 minute to restore someone from critical state to full hit points. So, either way, a physician spends a minute with you, you're back to full, whether you're on your arse or just kind of battered. This also allows the character to spend 30 seconds to reset the time on any poison on the target. Definitely want to cover poisons in another episode, but this could save your life. The character may spend 30 seconds role-playing with the target, at the end of which they can call execute on the target. This will not leave a physical mark on the target, so unless you have the mortician skill, you can't tell the difference. However, that's a 30-second play, so what someone will have to do is spend the first 30 seconds just pretending to heal them, and then at that 30-second point, switch. So your roleplay might be, right, let's staunch the wound, okay, we get some bandage here and pack this, let's get some epinephrine in there, and 30 seconds later, and right now, pass me the scalpel, yep, let's sever the aorta, good, the femoral artery, yep, that needs to be cut and rerouted, oh no, the patient is dead. That kind of roleplay. Maybe not as obvious, but you get my gist. Finally, when executing with the skill, so advanced physician skill, you must roleplay an attempt at healing your victim. So like I just said, you've got to make it look legit. Unlike other executions, this is subtle, and you may call the execute quietly by whispering in their ear. Very cool. Love it. That's it for the healing skills, that's the doctor skills. I really like how they structure this. It's 2 XP to basically get a field medic, staunch the bleeding, stop them dying. Mortician counters a murder. An advanced physician is your full heal in a single minute, which is pretty cool, and probably resource efficient versus using potions and the like. Of course, the risk is there till you kill someone, and if you do so, you can get away with it, because there's no mechanic here for identifying somebody who's killed your friend deliberately, unless they are a mortician. Of course, people are going to metagame this, which, it's LARPers, what you expect. They want to win. But on the flip side of this, I think having some accusations of physicians who genuinely haven't murdered their friend, and then going, oh well, if you've killed your target, let's say you're in the Assassin's Guild, and then you bring them to the doctor's tent, they're bleeding out, and they've got less than a minute left. Ah, no, it does pause their critical state. Damn it, okay, you got to bring them to the tent dead, and then you can just lie, deceive, deny. Oh, well, the physician must have killed them, because they were alive when I got here, and I can see that causing lots of wonderful drama. So there we go, that's healing in Menhirs Fate. Nice and simple, straightforward, We haven't talked about herbs or potions yet. I'm sure they'll have additions to this, but fundamentally, there's no anti-broken limb or anything like that. It's just heal to full, or heal a bit. That's it. Nice and simple. 10 out of 10. 3 thumbs up. Well done, Menhirs Fate. Another good set of rules. We'll catch you next time for maybe discussing potions and the like, and maybe diving a little bit deeper into what the hell an infernal wound is, and what on earth an underdweller could be. But until then, enjoy yourselves. Goodbye.